And I'm here also, being the first time. I congratulate you, my dear brother, for the leadership that Allah has bestowed on you. And He has seen your capacity. You have demonstrated in different fora, right from the time we were Honorable Commissioners of Health. You have shown exemplary leadership as of that time. So I'm not surprised that God has bestowed this on you again at the highest level. So I'm here to support you, Your Excellency, to do all we can, because I know your good intention and I know how you make things happen, inshallah. Your Excellency, in this my new role as a special advisor to President Bola Ahmed Tinubu, the President of the Federal Republic of Nigeria, it's a new position that was created for the first time in the history of Nigeria. And the President created it because of his passion and concern for health. Prior to the election, Your Excellency, I was opportune to work with the campaign team, which we call Health Transformation Coalition. It was led by Dr. Jide, and I was the co-convener, and I was leading the Northern Nigeria on that. And the only reason was for us to put health on the agenda. And we were concerned about health, especially in Northern Nigeria. That was why I took that responsibility. And for the first time, Your Excellency, you have seen it. APC had a mandate for health sector, pre-election campaign promises that were very articulate on 8 priority areas. So after the election, alhamdulillah, we won, and the President came on board. And he established what he called the Presidential Advisory Committee on Health, which he asked me to chair that committee with members, about 5 of us. And we defined the campaign promises, because for health, when you promise, you must deliver. We are living with life. We are dealing with lives of people. And we came up with 4 priority areas: 1 around governance issue, human resources, financing, integrated healthcare delivery services, public health emergencies, and global security. Also local manufacture, because President said we should stop importation of what we need in this country, especially health products. So that was also very critical to him. Another aspect, partnership, data management, to show that where we are coming from and what we have achieved. So all those 8 priority areas were endorsed by President. And when we had the Minister of Health, we handed it over to him and sensitized him. And he summarized it with a 4-pronged approach, which is the 4 health agenda around governance, population and health, global security, and also the supply chain, which deals with the issue of that. So, Your Excellency, I felt I should bring this background because you were part of it. So it's our party APC, because we are committed to provide health for Nigerians. And the commitment is to ensure that all Nigerians, irrespective of where they are, they have access to healthcare services, quality healthcare services, especially the vulnerable people. And when we talk about vulnerable people, they are women, they are children, the elderly men and women, and also the disabled people. They constitute most of them. And the poorest of the poor, which could be men and women that cannot afford healthcare services. Because we saw that 72% of Nigerians buy healthcare services out of pockets. And it has reached time that today it is so expensive to pay for healthcare services. So I'm here, Your Excellency, because of you, because of the Honorable Commissioner of Health, who has also reached out to me because of her concern for health. She came and said, I am the Honorable Commissioner, but I need help. How do you people help us in Sokoto State to achieve? Because my governor doesn't like failure, and I don't want to fail. So because of 2 of you, Your Excellency, we prioritize Sokoto State. President Bola Ahmed Tinubu is concerned about the health of women and children in Nigeria. And we came up with a presidential acceleration plan for reduction of maternal death and newborn death. Unfortunately, Your Excellency, I don't want to sadden you again because you were worried yesterday about immunization. But I saw you are on top of it. Insha Allah, you will change the narrative. Sokoto State has one of the highest burden of maternal death. Death as a result of pregnancy, childbirth, and post-delivery. If you look at the statistics, Your Excellency, I don't want to bore you with it, but you look at these 3 graphs, I wanted to put it on a color. You will find out that women that are assessing healthcare. In fact, let me start with the newborn. Most of the newborn deaths occurs in this state, in Nigeria. Looking at the NDHS survey of 2018, you will see that children, 44 out of 100 children born will die in Sokoto State, compared to the national average of 34. And then when you look at women that attend ANC antenatal clinic, you find out that more than 73% of women in Sokoto do not have access, or they decide not to go for reasons best known to them. And if you don't attend ANC, it means that if there are problems, it could not be detected. You will only come at the last minute with complications, and nothing much can be done. And then when you look at women that are delivered by skilled birth attendants, those that are trained like nurses, like midwives, in Sokoto State, you will see that they are very low, maybe 27% out of more than 50 deliveries per 100. So, sir, it is a cause for concern for us. Being from Borno State, I still want to have my brothers following us as usual. They need to, because we cannot succeed without Sokoto State. And we prioritize Sokoto State. And this is easy, sir. We can do it. And I believe that with your leadership, with your quality leadership and the passion you have, you will change the narrative. And that is why we are here, because it is doable. So why are we focusing on it, sir? I have shown you the statistics, and even the mixed survey that was done in 2021, which is the most recent one. You will still see that in Sokoto is still recording very low statistics, sir, from the mixed survey. Exactly. But the only good news, there's a good news, because we've invested so much in Sokoto since I was working with UNFPA. I started working with the UN 2002, and then left, came back to the government, and went back to my state. Back again. Family planning, which is one of the game changers. It reduces death of women by 30%. That is spacing of children at least 2 years before the next pregnancy. It nourishes the mother, it nourishes the baby. And that reduces. And we have seen increment in family planning utilization in Sokoto State, Your Excellency. And I want to congratulate you and the people of Sokoto State for taking that, because it has reduced the exposure and reduced maternal death. So that is a good news. But we need to do more for the antenatal care, and also when women come, because the highest point of death of women is when they're at the point of delivery. Number one is bleeding. 60% of the deaths are due to bleeding. Nothing you can do. Is like you open a tap and the water is rushing. And then number two is high blood pressure. So we must have services at the point of delivery through emergency obstetric healthcare services at the facility. Your Excellency, so that is why we are here. And most of this, the good news, 90% are preventable. Because if the woman does not bleed, she will not die. Even if she's bleeding, there is a solution to it immediately. Blood transfusion. Stop the bleeding, and she delivers her baby. The BP goes out, you remove the baby and give her all the antihypertensive drugs. She gets better. So you avert death at that point. And that is why it is 80%, 90% preventable. Your Excellency, sir, I'm here because it's a quick win. And I know how quickly you want to see results in your state. It's quick wins for you to attain universal healthcare coverage and strengthen the health systems. The women, the children are a critical part of the family. And when you strengthen the system, that is an entry for everybody. Everything improves in that facility. The men can go and weigh their blood pressure. They can also go and do their diabetes test. They become healthy by that availability of a strengthened healthcare facility. And it improves the physical and mental well-being of everybody, the family, the community, and the state, and improve productivity. Your Excellency, sir, we have our party chairman here. It is a political score, because you are working directly with the people at the grassroots. There is no family that will not be affected with it. Before you know it, it has changed everything, and everybody will be pressing the APC party chairman for the state for doing that, because every family will benefit from that impact and the overall socio-economic development. So, sir, we are here not to do things as we have been doing in the past. We have been talking about maternal death, immunization for a very long time, and yet we are not seeing changes, especially in northern Nigeria. So there's something wrong, I believe strongly, that we have been doing. I've worked at the international space and then back home. But we can't continue to be doing things. We are people that have a culture and have a tradition. So there is no way that things can change if we don't apply our own ways of doing things. So, sir, we are here to use only two-pronged approach. It has to be led by the state, and two, it has to be homegrown solutions. We need to explore our local context. What are our strengths? And what are our key sociocultural determinants that fuels this problem? What are the culture that we're so proud of? And what does it say about health of women and children? And how can we deploy those homegrown solutions for sustainable health outcomes? Your Excellency, sir, we don't want a situation where partners, development partners, will come and say, this is what we want you to do. But it should be the other way. This is what we have discovered, we've explored, and this is how we want to address our own solutions. Countries that we share similarities, like Saudi Arabia, like Egypt, like Senegal, which is predominantly almost over 90% Muslim community, they have done away and reduced maternal death to a barest minimum, that it does not have any public health impact in their countries. So if we are proud of our tradition and culture, we have lessons to learn from those countries and to generate our own homegrown solutions that no one needs to bring it for us to do it. So that is why we are here, Your Excellency. And I strongly believe that you will help us to see that, and we will support you to see that we achieve that. So without talking too much, I just want to have asked for 4 things only, Your Excellency. We want you to be the highest level give us the highest level political commitment to accelerate reduction of maternal and newborn deaths in Sokoto. So you can see results in 1 month, because every pregnancy, normal pregnancy, is 9 months. So I assure you, if we start today to enroll all pregnant women from today, in 1 year you will see results. It's not something that takes a long time to see results. In 1 year you will see all the pregnant women in Sokoto State, they were delivered safely by the grace of God, Insha Allah. So we want that commitment, and that's why we call it acceleration of reduction, because you can change it within 1 year. And then we want Your Excellency, sir, to be the chief advocate and champion for the state. You are the one that will say it, because they are hearing your voice, they are hearing your language, and you are the one that will lead that campaign, Your Excellency. We want you to give us the permission to explore key drivers in collaboration with our traditional leaders, in collaboration with our religious leaders and key influencers in the communities, to determine the social determinants and find out the root causes why a woman does not want to attend ANC, why a woman does not want to deliver in a facility that will save her life and the life of her newborn. Sir, if you give us this permission, those your own people will work and generate the problems and also come up with homegrown solutions that will be implemented under your leadership for sustainable and improved maternal and new health outcomes. So these are the only 3 asks, Your Excellency. And we are committed to support you. I'm committed to ensure that in the presidential initiative for acceleration of reduction of maternal death, Sokoto State comes number 1 on that platform. And by the time after 4 years we celebrate you, sir, Sokoto cannot accommodate you. Everywhere we'll be looking for you. Insha Allah. Thank you so much. And I really appreciate the opportunity given to us to present this to you, Your Excellency. Thank you.
Or at home, whenever you have a look, yes, it will fresh your memory that you have been to the seat of the candidate. Thank you very much, and I wish you a very, very safe trip back home.